Okay, well, here is one that we have all thought before, I'm sure. Does cranberry really help to prevent and treat urinary tract infections? It's something that I've personally wondered about because before discovering D-Mannose, I was relying quite heavily on cranberry to help stop UTIs. And then since using D-Mannose and noticing such a significant improvement in my UTIs, I got wondering what is so different about these two supplements. So I've had a look into cranberry, and the reason it is associated with the prevention of UTIs comes down to one particular tannin. It's a condensed compound called a proanthocyanidin. And what they found is that this particular tannin can help to stop E. coli bacteria from sticking to bladder cell walls. And as we know, E. coli bacteria is the main perpetrator of urinary tract infections. So, in a sense, it has been proven to be effective in the prevention of urinary tract infections, but that's where it stops, unfortunately. So, cranberry has not been shown to help actually treat an infection. So, what that means is when we get that initial niggle of a urinary tract infection, often we run to the pharmacy or the supermarket and buy cranberry tablets or cranberry juice. But by this stage, it's probably too late. So, cranberry is great to include in the diet for those in between times to try and stop any infections coming on in the first place. But once you do feel that bit of a sting, it might be time to look to something else. Something else I should add here is if you do look to add cranberry to the diet as a preventative agent, I'd strongly recommend the use of cranberry tablets, so a concentrated supplement, as opposed to cranberry juice, because cranberry juice contains a lot of sugar. So even just one serve, like a 250 ml cup, can contain up to 28 grams. And we just don't want to be putting that extra stress on our bodies at a time when we're trying to prevent infection. So tablets are the way to go. But remembering, as soon as you've got that feeling of an infection, it's time to look to D-Mannose or something else, because unfortunately it just doesn't have the ability to treat.